I'm Dr. Jason Rudolph. I'm an orthopedic surgeon. I have a niche subspecialty in foot and ankle injuries and surgery. I also do a fair amount of trauma, orthopedic fractures. I do a lot of sports medicine as well, but my real niche subspecialty is foot and ankles. Getting into medicine is something that I've always wanted to do. It's funny, since forever, when everybody asked me what I wanted to be, I always said I wanted to be a doctor. Now at the beginning, the reason I chose medicine was because I was going to cure cancer. I had a grandfather that died of cancer, and I was going to cure it. By the time I hit high school, I realized that I'm not going to cure cancer, and that I played so many sports, from baseball to basketball to football to lacrosse, that I saw so many injuries and injured myself enough that I decided maybe sports medicine is a better direction to go. So at that point, sports plus injuries plus medicine, that equaled orthopedic surgery. So even before getting into college, my goal was always to become an orthopedic surgeon. I went to undergraduate school at Princeton University, where I played football on the varsity football team, so suffered plenty of injuries and therefore can relate to athletes pretty well. After college, I went to medical school in Chicago at the Chicago Medical School. Then I came back to the East Coast, did my residency at Monmouth Medical Center, which is a smaller community hospital on the New Jersey shore. For my fellowship, I went down to Vanderbilt University in Nashville, Tennessee, which is now back to the big city again, where I spent a lot of time doing my subspecialty training in foot and ankle, as well as major orthopedic trauma. Going into my fellowship, at that point I was married. My wife, Dr. Stacy Resnick, also practices coordinated health. She's a podiatrist who does all foot and ankle injuries as well. The one thing she told me is, don't go into a foot and ankle, you can do anything else you want to do. So my fellowship originally was in just orthopedic trauma, and as it turned out, one of the leaders in the orthopedic division was the head foot and ankle, who had never had a fellow. And as it sort of played out, most of my time was spent doing foot and ankle injuries and reconstructive trauma injuries. At this point, there's plenty of different foot and ankle injuries, so we've managed to work it out. I can do anything from the end of the foot, hammer toes and bunion surgery, to the middle of the foot where you're starting to deal with more arthritis and bigger arthrodesis type surgeries or fusion surgeries. I've never told somebody, why did you come in? We're here, that's my job, is to see you as soon as I can, whenever I can. So when people thank me for being available to see them, that's the job, that's the deal, that's why I'm here. So last year I had a guy who was out in the woods deer hunting, fell out of his deer stand and had to crawl 2 miles to get to a street where they finally took him to the hospital, and he had a terrible ankle or distal tibia fracture, and that was sort of right in my ballpark. So less than a year later, he's back full-time to his life, although I'm positive he's given up climbing tree stands. I played sports my whole life. I have kids that now play sports, and now my guys are getting a little bit older, so now I'm still want to be involved, so now I'm trying to become more involved with those guys. And I think since I played sports, you understand the athlete attitude, and you understand the moms and dads and where they're coming from, and it's important as the team doctor or the doctor for the athlete, that even though they want to get out there as fast as they can, and you want to get them out there as fast as you can, a lot of times you have to talk from the doctor perspective and make people realize that's not always the safest thing or the best thing for the athlete, even though I know how much they want to get back out there and play. I knew I always wanted to be back in the Northeast. I grew up in New Jersey on the shore. I had family that were from Philadelphia and the area here. And from college, where I played at Princeton, we used to come up to play Lehigh and Lafayette, and I knew the Lehigh Valley fairly well. But now that the Lehigh Valley is this true cosmopolitan area and really a big city, although we're spread out over a large square mileage, we have the ability here now at Coordinated Health, where we have 6 podiatrists. We have 2 orthopedic surgeons specializing in foot and ankle injuries, that we can offer the complete treatment for any foot and ankle injury. And that means anywhere from diabetic shoe wear to orthotics to non-surgical treatment, we can offer now in-house. We have the ability to get an MRI done sometimes within the same visit that you're here seeing us. We have CAT scans. We have obviously high-level radiologists that read these things for us. We have the hospitals, the 2 hospitals and 3 surgery centers that we can do the actual procedures at. And now everything is offered within one facility, one community, and the communication between the different doctors, even specifically within foot and ankle, is so even, so open that there's no reason to go elsewhere for that, because we really have created a real complete team, I think, which nobody else in the Valley can offer.